People often ask when the best time or right time to have a facelift is, and there really isn't a specific age. For most of our patients, there comes a time when the face looking back at them at the mirror doesn't really match how they feel on the inside. And so what we try to do is address those concerns. And so while most people are in their mid to late 50s, there's a broad range of ages for undergoing facelift. There's no one specific technique for a facelift. So one of the most important parts of ensuring that we get great results is to invest the time up front with each patient discussing what it is that bothers you. What do you notice when you look in the mirror or when you see pictures of yourself? And there are some themes that start coming out. A lot of women and men are concerned about the jawline, the neck, some of the sagging tissues around the mouth, some changes around the eyes. But what I've found is that the strategy for a patient, the techniques chosen have to be highly individualized. So there's not one plan for every patient. For some patients, a facelift is a great choice, but then there are different facelift techniques as well. And we have to devise a strategy for the patient that addresses her concerns and her anatomy. There are choices to be made not only about the surgical technique, but also what other procedures we may offer. Because when we age, part of the changes that occur is related to the tissue sagging in the face, but there's also changes in the quality of the skin that can be addressed with skin resurfacing, for example, laser treatments and peels. There are also changes in the volume, so we'll often use other techniques at the same time, like fat grafting, injections. And so the first step really is that we spend time together. So I will sit with each patient and just invest the time, get to know them and what is her concerns? What is it that's bothering you? Let's devise a strategy that's very, very customized to your face and your life. Most people who get a facelift need about 3 weeks before they'll feel comfortable in public situations. And that's really kind of what I find the best way to describe it. Initially there's bruising and swelling, and so for 1, 2, or 3 weeks, most folks aren't going to feel comfortable going to social situations, going to work, that sort of thing. For most people, by the time 3 weeks has passed, there's not much left in terms of obvious bruising, swelling, etc., and other people aren't going to notice. The healing process continues much longer and really for many, many months. So one of the strategies we use is to make sure that the incisions are placed in strategic locations. So there's really there tends to be 3 locations for incisions with facelift, and they're all hidden. So one is in and behind the ear on either side, and the other is underneath the chin in a little crease that most of us have. And so the idea is it will take a while for those to heal, but we place them very, very carefully to avoid detection by others. And very routinely, by the time a few weeks pass, that's easily achieved. Consistently, our patients tell me that they sort of have 2 sets of goals with their facelift. One is they really want to look better. They want to look as good as they can. But the other way is they really want to look natural. Most people are very concerned not to look over-pulled or overstretched. And so both of these goals become incredibly important for how we approach each patient. We have to try to achieve as perfect an outcome as we can, as much improvement as possible, but do so in a way that ensures that this person's face and neck look natural and that other people can't really tell they had surgery. I've found over time that there are a few ways that we can make sure this happens. And so the first is, well, how do we get the best possible results? And I really see two parts to that. The first is customize the set of procedures. So I could see 2 women, both the same age, back to back in clinic, and devise very different strategies for how to rejuvenate their face and neck. Even the facelifting technique can be different from one patient to the next. It depends on the quality of the skin, how much fat is present in the different compartments of the neck, the anatomy and the relationship between the jaw and the neck. There are numerous little details that inform the plan. And it takes time to decide what the best plan is for any particular patient. And the next real, key aspect is in the execution, so during the surgical procedure, a facelift is a procedure that requires extraordinary attention to detail. So throughout the duration of the case, we really have to focus very, very carefully on fine details because there are numerous, countless little judgments made, artistic judgments really, how to reform the tissue, how to adjust the tissues and change the relationship between the different layers of the tissue. And what I have to do is do that in a manner that keeps in mind the big picture, which is, I have to make this face look as natural as possible. It's incredibly important to my approach, and I think this attention to detail is really, really the key. At Johns Hopkins, one of the areas I've focused on for many years is the treatment of facial nerve disorders. And for me, this is the perfect complement for facelifting. Every facelift I do, I draw upon years and years of experience with the facial nerve to make sure that my facelift patients are kept as safe as possible. I find that this gives a great deal of confidence to my patients that they're in the right place.